Administrator Lillian Posadas. Sorry, Dave. I'll just get Lillian on just really quick, and then we'll get to Labor Director Dave De La Sola. Mary Rhodes from the Guam Hotel Restaurant Association is also in the KUAM News Zoom room, and then we'll end it with the University of Guam's PMBA mixer coming up here. Okay, good morning, 9:13. Hospital Administrator Lillian Posadas. Lillian, thank you for joining us.
Good morning. Thank you for this opportunity also. So
Nice mask, by the way. I see you're supporting the Guam Memorial Hospital Authority with that mask. Yeah, Dave.
yeah, Team GMH.
Let's just start with what happened over the weekend. Can we get our COVID census count in the Guam Memorial Hospital?
Sure. Our census this morning is at 38. Of the 38, 18 of them are ICU. And of those 18 individuals who are ICU, 8 of them are on ventilator support. And we had some discharges over the weekend, which is good, meaning that these individuals have healed and have recovered from the COVID infection. So some of them have gone home to continue home isolation. Some of them were discharged to the government-sponsored isolation facility. So, that's the good side of, what's happening here is that there is that hope that people can heal and can recover from this COVID infection.
You talked about the hospital and Dr.
And
Uggan.
as far as the weekend,
Go ahead, Lillian.
the which one?
Go ahead.
No, and over the weekend, we lost some individuals. They fought hard to recover, but unfortunately, again, their systems, their heart, their respiratory systems just were so compromised from their underlying conditions that they succumbed to to this COVID infection.
Yeah, condolences to all the families. Today's September 21st. One of the previous interviews we did with you, you had mentioned that today is actually a key day in terms of you wanted to finalize that contract for the off-island.
I'm losing connectivity. It's breaking.
September-
Sabrina, I didn't quite understand what you were saying.
September 21st was that a deadline that you were shooting for to finalize that contract for the off-island medical professionals. And so were you able to finalize that?
Oh, the great news is we finalized. Hello?
Yeah.
There's quite a bit of a
Yeah, there's
disconnection
right. If you could just
going on, but the great news is we finalized the agreement Friday night. We have an officially signed agreement, and so those individuals from the staff solution company arrived on island, and they are here on premise. We're going through the onboarding process and orientation process. We've got a little over 15 ICU nurses. We've got some hemodialysis nurses, some telemetry nurses, and emergency room nurses. We also have 3 respiratory therapists from this staffing solutions. So they're here. The cavalry is here to augment what we have, as far as our own staff, plus the DOD EMAC staff who are here, who are eventually going to be phased out. They'll be leaving the facility. So at least there's no gap. There's no break in any, with the staffing. We've got now the staffing to help us through the rest of this COVID situation.
Well, that was quick. You signed the contract Friday, and the team.
Did I answer your question?
Yeah. So you signed the contract Friday night, and the team's already here. Is that pretty much what you're saying? Okay. So yeah, we are having a connection problems. I didn't get all the numbers that Lillian was saying, so I have to replay the video. But she did say that contract that we have been talking about on the air for weeks now was finalized on Friday night, and she was mentioning I'm sorry. Oh, she's there. Are you there?
Friday night it was signed. Yes.
Right, signed Friday night, and the team's already been deployed to Guam.
Yes.
Okay. And so as far as the medical team, the DOD team, their term expires on the 30th, I believe, right? So there's no extension to that because we've managed to demonstrate our ability to hire people on a long-term basis. Is that correct?
Oh, yes, but we're not hiring them. They're deployed by another agency. They're employees of another agency who will then assign them here. So really that's, part of our long-term plan to make sure that there's that continuity of resources. And so, yes, we submitted a request through the governor's office to extend the DOD, but from what we're hearing, it may not be extended, but it will be gradually phased out.
And do we know any more details other than this gradual phase out? Like how much longer they'll stay and gradually phase out?
We don't know. We don't have any definitive dates on that one, other than it ends on the 30th.
Okay.
Their deployment, them being here for 30 days ends on the 30th of September. And so they may begin phasing out, or they will wait, and start on the 30th or the 1st of October.
Okay. And in terms of the contract that was finalized, was it still the 117, 115 something an hour for the individuals that are here?
It was initially tagged at 195. We negotiated and we brought it down lower.
Okay. To how much?
About 145.
100 for each one, or is there a difference between whether a nurse or a doctor?
Each nurse per hour.
What about, is there any doctors?
No, we didn't get any doctors in this group. We've asked for intensivists and some doctors, but they weren't able to deploy or to find any of the doctors that will come to Guam.
So $145 an hour per each nurse that's here. And how long are they going to be here?
8 to 13 weeks is what we agreed. They're here temporary, but we have an agreement. So should we need to continue, getting the staffing from them, we have that option.
Just looking ahead, though, are you anticipating that you might need them?
Well, depending on our census and depending that, we continue to see numbers of COVID positive in the community. And so, give or take 20% of those individuals in the community are going to probably end up needing hospital care. Hopefully not, that they can manage and isolate themselves and, and recover without having to be in the hospital. But, we had to be prepared and plan that they may end up needing to come into the hospital. Especially those individuals with multiple health conditions and who are immunocompromised. They may need to be in the hospital.
Where's this team from?
They come from various parts of the United States, but the company is based in California.
Okay. What's the name of the company?
New West.
New West.
NU West.
Oh, NU West. And did they have to be tested for COVID before coming to Guam?
They were tested before they left their point of departure or wherever they're from. But we are also making sure that they will be tested, so we have a baseline information on their status, because with the travel, who knows, they may have caught it through the flights or at the airport.
Right.
We're making sure that we have a baseline data on that.
And boots are on the ground already as of today at GMH, or?
They are boots on the ground. They are here already. We're going through the onboarding process and orientation.
Okay. Anything else going on at GMH?
Oh, always, every day. Lots of food.
Lillian, I wanted to talk about the what you had talked about, the hope, right? People getting discharged over the weekend. We also saw people die from the virus. So where are we? Can you give us your assessment of the status of the Guam Memorial Hospital? Because over the last few weeks, we've been hearing bursting at the seams, teetering on the edge. Do we have a little bit of breathing room, or are these patients still so sick that we're not out of the jungle yet?
We're not out of the jungle yet, Chris. These individuals are still very sick, critically sick, and so they still need to be on supplemental oxygen. You know, and like Dr. Ogden pointed out, they could be fine 1 minute waving at you and going thumbs up, and then they crash. You know, it just really all depends on their system, you know, how compromised they are and the underlying medical conditions that they have. So we just have to be prepared and plan that, you know, anything can happen. Hopefully not, but, you know, we have to be prepared that anything can happen.
With the contract finalized and these additional medical team personnel that are coming to Guam, do you foresee the SIF being opened, or is that still planned?
That's the plan. That's the plan, is we want to make sure that, you know, we can utilize that facility because we were pushing for it. But we're also collaborating with GRMC to see what kind of help we can provide them now that we have some additional resources, because we're trying not to have any non-COVID patients. You know, like the non-COVID ICU, it's going to be over at GRMC. And so, you know, of course, they're challenged with staffing resources. So we're going to continue to work together to help each other with making sure that they have the resources also to take on, to continue accommodating the non-COVID patients.
And so the team that's here, that just arrived here, are they being sent over to GRMC or split, or are you sending the
We're discussing it. We're discussing it at our executive level that, you know, perhaps either our staff can be assigned over to the GRMC and handle, you know, and help GRMC with the non-COVID patients, or if they need, particularly ICU, because now we have you know, ICU staff nurses here, we can probably assign some of those nurses who are ICU with the specialty of ICU can work over at GRMC. So we're looking at those two options.
All right, thanks, Lillian. We've got to move on with the show. So again, we really appreciate your time.
Yeah, Lillian. I know I ask you every day to come on, but it's only because we love having you and you got that info that we all need.
Well, but it's also a way to help the community understand
Exactly.
what's going on.
Thank you. So you're always
Yes.
welcome. Thank you, Lillian.
Thank you too.
Take
That's
care.
that. Okay, so 9:25. We'll keep it going. Just a quick update from Labor Director Dave Delasolu, standing by in the KUAF News Zoom room. Sorry, Dave.